The important thing to remember with patient-centered care is really how involved patients can be in their care themselves. There's kind of three aspects that we think about. Patients that are quite passive and are happy for their doctors to make a decision for them. There's the shared decision making where it's a collaborative approach with their doctor. And then there's the really activated patient who's willing to make a decision themselves, perhaps even against their doctor's advice. Most of our patients in lymphoma, by far, want to participate in shared decision making. So they want that collaborative approach with their doctor. Less than 10% of patients, we were specifically looking in this instance at relapsed refractory CLL patients, had less than 10% wanted the doctor alone to make the decision. So really the focus is on how do we best make sure that that collaboration is happening. And from our survey data that we do, we saw that there are certain pitfalls that can interfere with their patient's ability to do that. One is how much really good, credible information they have about their disease. The other, of course, is just that dynamic of going into a situation that they're not familiar with terminology that they have to learn when they're highly stressed. So how do we make it easier for them? And really, the doctor plays a key role in welcoming the patient into that situation, in encouraging them to communicate what's happening to them, encouraging them to ask questions and then also respond to them, which is right now often a gap. And then when they're getting to the point that they need to make a decision, that the patient feels like sometimes they can question the doctor and say, I don't have enough information. Can you tell me more about the side effects? Are you taking into account that this is how I like to live my life? And all of these things can affect what is the best choice for a patient. Now, the patient, if you ask them, do you want to help make a decision about your treatment, may not want to do that because it sounds very overwhelming and huge. But helping them understand that their preferences, what they're willing to tolerate, what they're not, can contribute to that decision making is what we really want doctors to focus on, so that they're listening to the patient talk about those things and incorporating it when they're presenting their patient options for treatment.